I'm your Dr. Manchester. Okay, right. Good afternoon, everyone. I want to talk about something, a health thing that a lot of us know about, HIV/AIDS. You know, as far at the point in one of the places I worked, I was the HIV so-called doctor. Everybody knew me as HIV doctor because I was the focal person. I was the HIV team lead for about 5 years, and I had about, not mincing words, now I have about 4,000 patients on HIV drugs. And these people cut across every cadre of our society. I had a minister that comes from Abuja, I had reverend fathers, I had imams, I had police officers, I had soldiers, I had people who were coming from Lagos, I had people who were coming from Enugu, all the way to Kaduna to collect HIV drugs. Now, why am I talking about this? I'm talking about this because, of course, I am vast. I have a lot of knowledge about HIV management. And I want to tell you a story. You know, one of the things about HIV is that there's this confidentiality because of stigmatization. We stigmatize a lot of people that have HIV. We look down on them and things like that. Please, that should stop. It should stop. Because it's when people tell you they have HIV that you look down on them. When they don't tell you, you don't know. And I'll give you a classical example. I remember I was giving a health talk in the hospital once, and the whole staff of the hospital were there, and I was telling them, because our hospital was a big trauma center, and when we have emergencies, when there's accident in Kaduna that time, everybody comes to our hospital. You understand? Everybody comes to the hospital, they brush all emergencies. So there's sometimes when there's mass casualty like that, we call for everybody in the hospital to come and help. I remember one day I was on call and they brought about 60 emergency patients with accidents, different injuries and that's when you see everybody come. Nurses, doctors, everybody will come and help. At that point, nobody knows who has HIV or who does not have HIV. Everybody just helping. Sometimes blood pour on them. Nobody is running. Everybody just helping because you see injuries and you are helping. But immediately they tell you that this patient has HIV. That time I remember they say, I call Dr. James. He's his patient. And I used to tell them, when you are attending to a patient and you know somebody's status, it is safer for you because you already know his status. It is safer for you to take precautions, to wear your PPEs and things like that. So let us stop stigmatizing people living with HIV. Many people in your family, in your church, in your compound, live with HIV, but you don't know because they've not told you. Please and please, stop it. Maybe if somebody has HIV, stop maltreating the person. And if you are living with HIV, it's not the end of the world. Many people live with HIV. It's because they have not told you. I see them. I see ministers. I see